news.
Well, Wisconsin is facing an EMS shortage and state lawmakers are scrambling to fix it.
News 8 Now's Allison Fergott has a closer look at their plan.
New measures in the Wisconsin legislature are looking to strengthen the state's EMS.
Everyone is dependent on EMS.
It's a crucial service, but Wisconsin EMS systems are facing challenges. One of the biggest issues, finding personnel.
I don't know of any other job that you're required to have education and licensure and often asked to do it volunteer.
The situation is heightened in rural areas where services depend on volunteers and residents face longer transport times.
There's more time for the patient to get more ill if they're not getting appropriate care initially.
As Wisconsin's EMS reaches a critical point, the state's lawmakers are proposing new legislation to help.
We need to make sure that all communities, including and especially I will say rural communities, have access to emergency medical technicians.
One of the bills would create a program to reimburse the costs of initial EMS training classes, which can run in the hundreds and even thousands of dollars.
This training is not free. The state needs to step forward and provide greater tuition assistance.
We can lower that barrier to entry. We're going to get more people in the door.
The bills would also increase certain ambulance service reimbursements and encourage smaller EMS systems to collaborate. But the bills themselves are facing obstacles, despite having bipartisan support. Last week, the state Senate passed the tuition reimbursement bill, but did not include any funding in order to carry out the policy.
I really think that we as a legislature are making a mistake if we do not fund innovative policy to grow and enhance our local EMS assistance.
Republicans said they chose not to include funding because they have no trust in Governor Tony Evers' office. Reporting in La Crosse, Allison Fergott, News 8 Now.
Thank you, Allison. And PAF is hopeful that once the budget is finalized, that there will be money set aside to fund the programs created in those EMS bills.